I'm Dr. James Whitaker, and today we're addressing a topic that brings up tremendous curiosity, anxiety, and unfortunately, massive amounts of misinformation. What is normal penis size? And even more importantly, how do you accurately measure both length and girth? The hidden crisis of male body image. With the dramatic rise in male genital cosmetic procedures, this question has become increasingly common in doctors' offices, online forums, and social media discussions. But before we go any further, I want to start by reassuring you with something that might genuinely surprise you. Around 95% of men who worry about their penis size are actually within the medically normal range. Yes, you heard that correctly. In the vast majority of cases, we're not talking about a physical issue, but rather a severely distorted body image problem. Many men perceive their size as inadequate due to unrealistic comparisons, especially with what's portrayed in adult films or online content, where exaggerated or even digitally altered bodies are routinely shown as normal. This creates a completely false baseline for comparison. The gender perspective gap. What's also fascinating from a psychological standpoint is that this concern is far more prevalent among men than their partners. While approximately 55% of men report feeling anxious or dissatisfied about their penis size, only 5 to 10% of women say they consider it a very important factor in partner selection. This massive discrepancy suggests that much of male anxiety around size is internally generated rather than based on external feedback or actual partner preferences. The pressure men feel is often self-imposed and based on misconceptions. My mission: education over anxiety. So take a deep breath and relax. My goal here is to educate, inform, and most importantly, put your mind at ease with scientific facts rather than cultural myths. In today's comprehensive guide, I'll share real scientific data from major research institutions, explain exactly how to properly measure both length and girth, review enhancement procedures and their significant risks, and share historical perspective that might completely shift your thinking. The foundation proper measurement techniques. Let's start by learning how penis size is measured correctly, because this foundation is essential for understanding what's actually considered normal. There are two main dimensions to consider: length and girth, which refers to the circumference or thickness of the shaft. Measuring length, the scientific method. Penis length can be measured either when erect or when flaccid and stretched, and both methods are used extensively in scientific research. However, the most consistent and clinically reliable method is the flaccid stretch length, which correlates very closely with erect length. To measure correctly, follow these precise steps. First, use a rigid ruler or measuring tape. Flexible measuring tools can give inaccurate readings. Second, place the ruler at the pubic bone, right where the penis meets the body. You may need to gently press into the fat pad to reach the actual bone structure. Third, stretch the penis out, not forcefully, but firmly while flaccid, and measure to the tip of the glans, which is the head. The same process applies when measuring an erect penis. Start at the pubic bone and measure to the tip, keeping the ruler on top and properly aligned with the shaft. Critical measurement mistakes to avoid. It's absolutely crucial to avoid measuring from the skin surface or from underneath the penis, as this adds artificial length and leads to completely inaccurate numbers that don't correspond to medical standards. Many men unknowingly sabotage their measurements by using these incorrect techniques, then compare their results to properly measured scientific data, creating unnecessary anxiety and distorted self-perception. Subscribe to the channel right now. If you're finding this scientific information valuable, I share evidence-based men's health content every week that could transform your understanding of normal male anatomy and health. Hit that subscribe button and notification bell so you never miss crucial medical information. Measuring girth, circumference accuracy. Girth measurement is just as important as length and can vary significantly between individuals. This measurement often correlates more strongly with partner satisfaction than length, making accurate measurement particularly important. To measure girth properly, first take a soft measuring tape or flexible string. Rigid rulers won't work for circumference. Second, wrap the measuring tool around the midshaft of the penis, positioning it neither too close to the base nor near the tip, as both areas can give misleading measurements. Third, record the measurement where the tape meets itself, ensuring the tape is snug but not compressed against the skin. You can perform this measurement both flaccid and erect for comparison, but in most scientific studies, erect girth represents the standard measurement. Common measurement errors that create anxiety. Many men significantly overestimate or underestimate their size due to poor measurement methods or by comparing themselves in non-erect states to others in fully erect states. This creates completely unrealistic expectations and unnecessary psychological distress. Understanding proper measurement technique eliminates these variables and provides accurate data for meaningful comparison to scientific norms. Now that we understand correct measurement techniques, let's examine what rigorous scientific research actually reveals about normal penis size. There was a landmark large-scale meta-analysis conducted using data from nearly 15,000 men worldwide. This type of comprehensive study combines data from multiple research papers across different populations to produce highly reliable statistical averages that account for genetic, ethnic, and geographic variations. Let's consider length statistics, the real numbers. When measured erect or flaccid and stretched, approximately 90 to 95% of men fall within this scientifically established range. Length between 10 and 16 centimeters, which equals roughly 4 to 6.3 inches. The global average length is approximately 13.2 centimeters, or just over 5 inches. So if you fall somewhere within that range, you are completely, absolutely, medically normal by every scientific standard. On the extreme ends of the statistical spectrum, there are specific medical definitions that help identify genuinely unusual cases. A micropenis is medically defined as an erect or stretched length of less than 7.5 centimeters or approximately 3 inches. A macropenis, which is extremely rare, is usually considered anything above 24 centimeters or over 9.5 inches. However, these cases represent statistical outliers and account for only a tiny fraction of the total population. Girth measurements also vary considerably, and again, the majority of men fall into clearly defined normal ranges. Flaccid stretched girth typically measures between 8 and 10.5 centimeters, which equals 3.1 to 4.1 inches, with an average of 9.5 centimeters or approximately 3.7 inches. Erect girth measurements range between 10 and 13 centimeters, approximately 3.9 to 5.1 inches, with an average of 11.5 centimeters or about 4.5 inches. And yes, the comparison trap. When people discuss being average, these scientific measurements represent the real numbers they should reference. Unfortunately, many men compare themselves to completely unrealistic standards, especially those portrayed in adult films where performers are specifically selected for unusual size. Even within that selected population, camera angles, editing techniques, and digital manipulation grossly exaggerate visual perception, creating a completely false impression of what constitutes normal male anatomy. Leave a comment below. And tell me if this scientific information has changed your perspective on normal penis size. I read every comment and often provide additional clarification based on your questions. Also, share what country you're watching from. I love connecting with men worldwide who are seeking accurate health information. The enhancement industry, separating facts from marketing. Now let's discuss something that increasing numbers of men have become curious about: penile enhancement procedures. It's completely natural to wonder about possible improvements, but it's critically important to separate medical facts from aggressive marketing hype and fully understand both risks and limitations. Girth enhancement, the popular option. One of the more commonly performed cosmetic procedures focuses on increasing girth, and the most frequently discussed method involves injecting hyaluronic acid. Hyaluronic acid is a substance naturally found in human body tissues and is commonly used in facial cosmetic procedures. When injected along the shaft of the penis, it can temporarily increase girth by 2 to 3 centimeters. The effect typically lasts approximately 12 to 18 months, depending on the specific product used and individual metabolic factors. Hyaluronic acid is considered relatively safer than alternative substances because it's naturally absorbable by the body over time, reducing the risk of permanent complications. Dangerous enhancement substances to avoid. However, not all injectable materials are safe or medically appropriate. Some clinics offer non-absorbable fillers such as PMMA, polymethyl methacrylate, or even industrial-grade silicone. These substances can cause severe, life-altering complications. Complications include chronic inflammation that doesn't resolve, hard lumps or nodules under the skin, permanent deformation of penis shape, irreversible damage to sensitive tissues, and infection risks that can threaten overall health. For these serious safety reasons, non-absorbable fillers are explicitly not recommended by reputable medical organizations worldwide, including the American Urological Association and similar international bodies. When it comes to increasing actual length, available options are far more limited and significantly riskier than girth procedures. Two procedures are sometimes offered, but both have substantial limitations. First, liposuction of the pubic area removes excess fat tissue around the base of the penis, making more of the existing shaft visible. This doesn't actually increase penis length. It only improves visual appearance by removing obscuring tissue. Second, suspensory ligament release involves surgical cutting of the ligament that holds the penis close to the pubic bone. This procedure can add approximately 2 to 2.5 centimeters of visible length when flaccid, but it doesn't increase erect length at all. Ligament release surgery carries significant risks, including instability during intercourse, substantial risk of surgical complications, potential scar tissue formation that can worsen function, and possible loss of the upward angle during erection. Importantly, there are no permanent, approved methods for true penile lengthening that are endorsed by major medical organizations, including the American Medical Association, the European Association of Urology, or most international medical regulatory bodies. Let's talk about penile implants, medical versus cosmetic. It's crucial to clarify that penile implants, which are sometimes mentioned in online discussions, are not designed for size enhancement. These are legitimate medical devices used specifically in the treatment of severe erectile dysfunction and are only recommended in specific clinical cases where other treatments have failed. Implants are major surgical procedures with significant risks and are never appropriate for cosmetic size enhancement in men with normal erectile function. Cultural myths about size. To provide complete context, I want to share fascinating historical perspective that might fundamentally change how you think about this entire topic. In ancient Greek culture, which significantly influenced Western ideals of male beauty, the ideal male body was actually portrayed with a smaller penis. Smaller size was considered a clear sign of wisdom, self-control, intellectual sophistication, and rational thinking. In direct contrast, large penises were often associated with barbarism, lack of personal discipline, or comedic exaggeration in theatrical performances. Ancient art and size ideals. Examine classical sculptures of revered gods, philosophers, and heroes. You won't find oversized genital anatomy. When large penises did appear in ancient art, they were typically part of caricatures or depictions of mythological figures like Priapus, who was specifically portrayed as grotesquely exaggerated for comedic effect. This historical evidence demonstrates that cultural ideas about masculinity and ideal penis size changed dramatically over time and across societies. What's considered ideal in one historical era can be completely opposite in another period. This means that much of the anxiety men experience today is based primarily on temporary social influences rather than biological truth or partner preferences. The current cultural obsession with size is historically unusual and not representative of human attitudes throughout most of civilization. Your worth isn't measured in inches. If you've ever felt insecure or pressured by what you see online, in media, or from locker room conversations, understand that you're responding to artificially created cultural pressure, not biological reality or partner expectations. Hopefully, this comprehensive scientific overview has helped put these concerns into proper perspective using actual medical evidence rather than cultural myths or marketing manipulation. At the end of the day, penis size does not define your worth as a person, your ability to satisfy a partner, or your masculinity in any meaningful way. What genuinely matters is your confidence, your respect for others, and your overall health, both physical and emotional. Sexual satisfaction depends far more on communication, emotional connection, technique, and mutual respect than on anatomical measurements. Partners consistently report that these factors matter much more than size variations within the normal range. If you found this evidence-based content helpful, please like this video, subscribe to my channel, and turn on notifications so you don't miss more science-based, judgment-free health information like this. Remember, I'm Dr. James Whitaker, and my mission is providing men with accurate, evidence-based health information that reduces anxiety and improves understanding of normal male anatomy and function. What surprised you most about the scientific data on normal penis size? Leave a comment and let's continue this important discussion with facts rather than myths. Thank you for watching, and remember, you're normal, you're valuable, and you deserve accurate health information rather than cultural manipulation.